The Sidelying Senergy test is an assessment of isolated movement of the upper extremity. Begin with your patient positioned in side lying. To assess shoulder flexion, begin with the shoulder, elbow, and wrist positioned in extension. Instruct your patient to lift their arm without changing the position of their elbow or their wrist. Support the weight of the arm and feel for any flexion occurring at the elbow or at the wrist. Okay, begin. Good, come on back. If your patient is able to move through full shoulder flexion without flexion occurring at the elbow or the wrist, the movement is considered to be selective. If your patient is able to move through at least 50% of shoulder flexion before wrist or elbow flexion occurs, the movement is considered to be selective with pattern overlay. If your patient is able to initiate shoulder flexion, but before 50% of the movement is complete goes into elbow flexion or wrist flexion, the movement is considered to be deviating from pattern. If wrist or elbow flexion occurs upon initiation of shoulder flexion, the movement is considered to be patterned. To assess isolated elbow flexion, begin with the shoulder, elbow, and wrist positioned in extension. Instruct your patient to bend at their elbow without changing the position of their hand or their shoulder. Good. Feel for any movement into shoulder flexion or wrist flexion during the elbow flexion. To assess for isolated wrist flexion, begin with your patient positioned on their side with their shoulder, elbow, and wrist positioned in extension. Instruct your patient to bend at their wrist without moving their elbow or shoulder. Good. Feel for any movement into elbow flexion or shoulder flexion. To assess for isolated shoulder extension, begin with your patient positioned in wrist, elbow, and shoulder flexion. Supporting the weight of their limb, instruct your patient to move their shoulder backwards without moving the position of their elbow or their wrist. Feel for any movement into wrist or elbow extension. To test for isolated elbow extension, begin with the shoulder, elbow, and wrist positioned in flexion. Support the weight of the limb and instruct your patient to straighten their elbow without changing their position of their hand or their shoulder. Good. During this movement, feel for any movement into shoulder extension or wrist extension. To assess for isolated wrist extension, begin with your patient on their side with their shoulder, elbow, and wrist supported in flexion. Instruct your patient to bend their wrist back without changing the position of their elbow or shoulder. Good. As your patient moves, feel for any movement into shoulder or elbow extension.